Wits University's HIV and AIDS wing has applauded the U.S. Food and Drug Administration's approval of the first ever long-acting HIV prevention injection. Pre-exposure prophylaxis, or PrEP, involves taking an antiretroviral to prevent HIV infection. We're joined to explain the significance of the approval for South Africa by Pontsho Pilane, Head of Communications for Wits RHI Research. Thank you so much, Pontsho, for joining us this afternoon. I stand to be corrected, but I think South Africa was the first to approve this technology in the form of a pill anyway on the continent. Just give us a little bit of context as to how we got to this point.
Thank you so much. And yes, you are correct that South Africa has been at the forefront of rolling out the daily PrEP pill, which we can call, to just explain it, is an HIV prevention pill. Most people know the post-exposure prophylaxis, which is usually taken by people who are at risk or think have been exposed to HIV, whether it's through sexual activity or having sex with a partner that is HIV positive and maybe a condom broke, or when somebody has been raped, one of the things that they're given is that they're given post-exposure. Pre-exposure prophylaxis, which we call PrEP, has been available in South Africa for a number of years in the form of a pill. But now we have groundbreaking approval from the Food and Drug Administration in the U.S. of the first ever long-acting HIV prevention injection, which is called CarboTega, or we call it quite shortly CABLA. And Wits RHI did research in this in a clinical trial last year, where results showed that this is more effective at preventing HIV than the daily pill. And it's an injection that people would have to take every 8 weeks instead of a daily pill like the current HIV prevention pill allows or is administered.
Let's expand on the trial known as HPTN 084, which included a number of countries on the continent.
Correct. In the number of years, like I said, last year, Wits RHI released these results of the HPTN 084 study. The study was done and headed by our Director of Research at Wits RHI, Professor Sinead Delaney Muretwe. And the HPTN 083 study enrolled over 4,500 cisgendered men and transgender women who have sex with men at research sites across the world, not just here in South Africa, including in Argentina, in Brazil, Peru, and Thailand, and even in the USA. And in this study, what researchers saw is that there were HIV infections that occurred. However, the findings translate that 69% reduction in the incidences of HIV for the study participants. I'm talking about that 4,500 study participants that were enrolled in the study. And then the HPTN 084 study enrolled about 3,200 cisgendered women in Botswana, Eswatini, in South Africa, Malawi, and Uganda, and Zimbabwe. And there were 3 new infections in the CABLA arm. So this is in the participants that got the long-acting injection, HIV prevention injection. There were 3 new infections, and it showed that this translated to about a 92% reduction in the incidence of HIV infections in the participants who were given this long-acting HIV prevention that we call shortly as CABLA, as compared to the other which was with the daily PrEP pill, as I said. And so what it shows us is that there is this approval, particularly of the injectable CABLA by the US FDA, is really a milestone that says that we could see this coming to the country, to South Africa, but to also other countries that are burdened with HIV in the same way for us. You know, in the field of HIV prevention, we have committed to the UNAIDS 95 goals, which one of them is to get as many people to prevent new infections, but also to get as many HIV positive people onto treatment. And with these global commitments that we've made, this recommendation by the FDA is important because it is, one, inclusive of all populations of people, including adolescent young girls and women, or adolescents in general, who are at a higher risk of HIV. But particularly, it's also an important signal to other drug regulatory authorities, such as our own, the South African Health Products Regulatory Authorities in the African region, to say, a strong recommendation from the FDA may support the in-country reviews and recommendations that are saying. So yes, it's not approved yet in South Africa, but a recommendation from the FDA, as we've seen this, really yields well and bodes well for what we could expect in South Africa and other countries in our region that really, really need to see this come through.
What did the study find in terms of side effects, if any?
So there are, one of the things when I was still a health journalist covering the HIV PrEP pill, one of the biggest things that came out, and even a couple of weeks ago when our researchers the Wits RHI researchers were at the ICASA conference in Durban, one of the slow uptakes with the HIV prevention pill, the daily pill, is that you have to take it every day at the same time. And it's not as discreet as one would find the 8-week injection to be. So when I've interviewed young women, sex workers who are taking the HIV prevention pill daily, they find it hard to negotiate negotiate with their partners, sexual partners, and even families around taking it daily. So we must understand that the reason that these HIV prevention pills or interventions exist, right, where we find that South Africa has the largest population of people living with HIV in the world. We also have the largest HIV treatment program. But particularly when we look at adolescent young girls and women, what we find that condom negotiating safe sex with their sexual partners is a big problem. So they end up being exposed or at high risk of being infected with HIV because they simply cannot negotiate HIV safe sex and their risk, lowering their risk for HIV. So when they take this pill or this injection, it means that they have more autonomy, bodily autonomy, on what they can do or to prevent HIV infection. There are side effects as with any medication. However, because this with the HPTN 083 and 084 studies, it was shown that the long-acting HIV prevention injection has lesser side effects than the daily HIV prevention pill. And so when we're looking at the side effects in terms of what will even work better, the research showed that the injection has less side effects, and the fact that it's only every 8 weeks instead of a daily pill, people are more amenable to taking it. And this bodes well because if we are trying to reduce the HIV infections in South Africa, particularly amongst adolescent young girls and young women, it is important to have HIV prevention methods like this. And at the moment, we only have, obviously we have condoms, but if when talking from a biomedical perspective, we only have the HIV prevention pill. And this is now adding to the more methods that we have, or that young people or anyone who finds themselves at risk of HIV infection to protect themselves from being infected with HIV, or to lower their risk of HIV infection.
Pontsho, I'm going to ask you to please very succinctly just answer these two questions for us. So other forms of prevention like condoms, like the PrEP pill currently are free, right? So what is the cost, do we know, or anticipated cost of this injection? The second question being that how do we better, communicate this information in terms of reporting on public health interventions? A number of people saying, oh, I didn't even know that we had this.
This is very true. It's one of the biggest problems that we have. So just to answer you around the cost, in the same, because it hasn't been approved in South Africa, it is very hard to know what the cost would be. But from just seeing that the HIV prevention pill is available for free in government or public health facilities, we're more likely to see the same with the injection. And coming to your question around information and addressing this, one of the challenges when Professor Saika Malik, who is one of our directors at Wits RHI, was at the ICASA conference, and they were discussing the challenges with our PrEP rollout in Africa and in South Africa. One of the challenges was even around language barriers, the fact that we have not even developed words to explain what PrEP is or what is PrEP in isiZulu, and the lack of communication around and explaining, and the stigma that exists around if you are taking PrEP, it means that you think you're promiscuous, or that even partners think that you might be saying that you're not trusting your partner. So I think there's a lot of communication and awareness and education that still needs to happen on this, but it is really a good sign that the FDA has approved this, and it's great news for HIV prevention across the world, particularly on our continent and in South Africa, when we look at the numbers and the population of people living with HIV that we have, and especially young women and adolescent girls who are more at risk and disproportionately affected and infected by HIV.
A big congratulations to South African researchers involved in this, and thank you very much for your time this afternoon. Pontsho Pilane is Head of Communications for Wits RHI Research. Thank you.